Yeah, I remember I was an intern on my general surgery rotation. It was early in the morning, like 6 a.m., and you go in and you round on all the different patients on the service. And I think we just switched services. So it was my first day on that rotation in general surgery, going around and, on the people and making sure, seeing how they're doing in the morning. And if they need surgery, you kind of make sure that they're all prepped up for surgery, that they have their consents or whatever it is. And I remember I walk into this one patient's room. He's Caucasian male. And before I could say anything, he was like, "Are you my doctor?" And I was like, "Yeah, yeah, I'll be your doctor for the day." He was like, "I don't want you. I don't want a black doctor. I want a white doctor." This is before I said anything. Like, I was like, it caught me a little off guard at first, right? And he was like, "No, I want a white doctor." And, I tend to have a pretty chill personality. So I was just like, okay, whatever. We'll get you, if you don't want a black doctor, it's completely fine. I'll get somebody else for you. It's no problem. And that, was an interesting experience to start off as an intern in general surgery, just because you're always reminded a little bit that you have the color of your skin, right? In many different places and many different times, right? Another time is I think I was a chief resident actually. I was a chief resident going in the hall to go around on the patient after leaving surgery. So I still have like the scrubs on. I still have a scrub cap on my head, and I'm walking around the corner to go and walk to the patient's room. And one of the nurses that is there is a guy that I hadn't seen before. But I walk around the corner, and he's like, "Oh, hey man, I'm glad you're here. Yeah, the trash can's over there. You can go take it out." I swear, first thing he said to me. And I was like, it's all about how you react, right? In the way that you carry yourself. And me, I was just like, "Oh no, I'm actually the doctor. I'm here to see the patient." And he's, "Oh no, oh so sorry," very apologetic. And so, you can react of one of two ways. You can get mad and curse him out and, and make a big scene out of it, or you can just carry yourself with composure, stay chill and say, "Oh no, I'm actually the doctor." But whenever the person that gets here that's supposed to do it will make sure that it gets done. That way you're still being nice, but you're also communicating the fact that, yeah, I'm confident and this is what I do. And no, actually there are doctors that look like me. So I think when it comes down to it, wherever you go, you'll probably face something, right? I think there are special places like Morehouse School of Medicine or Howard, one of these historically, ethnically diverse, I think that's the right way to put it, ethnically diverse institutions where you may get not a false sense of security, but you'll forget like this isn't how it is in the real world. Like you go out in most places and you're most likely the only person of color, right? And so you
Yeah.
just gotta fall back on your training and remember that you are